Okay, hi there. My name is Roxanne and this is Nikolai on the table here. We're both registered massage therapists and I'm doing this video series on how to avoid, RSIs and discomfort after, a heavy workload of seeing, patients as a registered massage therapist or other body worker. So I was just showing a demonstration earlier about this, and here I am. I've got my left hand as the area that's close to his body that I actually am feeling with, and then I'm putting compression through my my right thumb here. And so again, I can stand here and I can actually be very, very static, and I can just put pressure into him. And I would imagine that he would be feeling that as sort of point tenderness into the spinous process there. Whereas if I stand back a little bit and I push through my pelvis, if I actually use some movement, if you can see that through my body, and I'm kind of putting weight through my arm, basically from what's happening lower down, I feel like the sensation for the client is actually more pleasurable. It might be a deep work technique, but it's actually something that is sort of more tolerable because it doesn't have that kind of pointy sort of bone tenderness feeling. Would you agree with that, Nikolai?
Certainly more tolerable, yeah.
Yeah, exactly. And so that can be actually related. And the other thing is that, you should, I encourage you to try to, use one of your thumbs and then use the other thumb so that you can push through one side, you can have one leg forward and the other leg back, and you can just kind of, throughout the day be giving yourself a few options so that you're not on autopilot all the time. This way, the one thumb won't have the overuse that the other thumb, because you're kind of using them off from one side to the other. I mean, it would be the very same here. I could do this or I could do that, right? So, I mean, if you see me moving my pelvis here, the movement of my pelvis is actually helping me move my hand, right? And so it's not like I'm static and I'm doing this. And, that's very satisfying. I mean, compression in the thumbs is something that is very common for RMTs. Another thing is that techniques such as C-squeezing and squeezing the musculature can become super habitual, where the hand maybe on the other muscle groups of the legs, doing a lot of this kind of compression type work, will bring our hands into flexion a lot more than keeping them in extension. So a little tip for that is when you go to bed at night, try to keep your hands flat, put them underneath your pillow, or I even recommend that to my clients because Dupuytren's contracture or Dequaveins, or these RSI problems that begin to, where flexion is more dominant than extension. And I mean, that's also a postural thing that is something that's fairly rampant with RMTs that have been in practice for a long time, a bit of kyphosis just simply from bending down. Okay, so that's just looking at the right side, looking at the left side, using yourself differently, giving yourself some options. And the same would be with the elbow. You could come in with your elbow, you could support your elbow with your other hand, you could have both of these working together. And then when you switch sides, you would do the very same thing on the other side, obviously, and it will feel less familiar or less easy, and that's okay. You just want to cultivate over your career your best ambidexterity. So yeah, that's something to think about.